I am currently employed as a psychiatric oncology provider. I lead a team of people at a large health system. I was the first employed psychiatric provider on the medical side, actually, in 2004, where I was given the opportunity to start an embedded psychiatric oncology program. Since my joining there in 2004, I was the only employed mental health provider for about 4 years on the medical side, and then have grown to a large team of advanced practice nurses and licensed clinical social workers, as well as music and art therapists. And I could certainly talk about the number of patients that we've seen, or the, different ways that we've helped the cancer program keep its accreditation, because it's a standard of the American College of Surgeons to have mental health care accessible to patients going through their cancer treatment. But I think the story I would tell is we did this hand wall at the cancer program. They built a healing hand wall, and people got to, it was patients or a caregiver. They were asked to come and put their hand into this wall, and an artist came and made it out of glass. And each patient got to ask someone that they wanted to hold their hand. And it had probably been 6 or 7 years since I had seen this individual, but I got a call from a spouse of a patient that I'd taken care of, and he asked me to hold his hand because I had helped him help his wife die. And he said that you literally held my hand when I didn't know how to do that before. I'd never done that. And I think what that showed me is that that was something that I did every day. Like, I help people have hard conversations with their family every day. I help people go through things that are seemingly unimaginable. And that was so common for me. I think what that told me is we never know the impact that we're making on someone. I mean, I feel like psychiatric nurses could be in every facet of healthcare. There is rarely a medical diagnosis that doesn't come with some sort of uncertainty, newness, tests that you're going to have to go through. But I think we could be doing this in cardiology, maternal fetal medicine. We could be doing this in endocrinology, diabetes care. So much of what people are going through in medical specialty care, it's impacted by our emotions, our sleep, our behaviors, how we interact with our nutrition and physical health. And I just think that the more we could include and embed mental health across medical specialties, I think patients would do better. So I think for me, it's really validating to know that the work that I'm doing is good work, even if I'm still fighting a hard fight to get psychiatry acknowledged in other aspects of care. I think where I'm really fortunate is that the cancer program sees the value. I think the next level of advocacy that I've taken on is figuring out how to get psychiatry available for other patients.